This is skin cancer. No? Nakita mo yung irregular margin, merong ulceration sa gitna. No? Typical. No? So, ang principle dito, most likely, and for all practical purposes, basal cell carcinoma ito. Characteristic nito, no, it invades the surrounding tissue. So unless you remove it, it will eat up all the structures around. Ang advantage lang ng basal cell carcinoma, it rarely, if ever, metastasize doon sa mga distant organ system. In other words, it's locally invasive. Now, but we have to remove it. Okay, we have to do a curative resection. And the bigger the lesion, the bigger the margin of resection. Yun ang principle. To have cure. Okay? So, kung mapapansin mo, yan ang margin niya. And it is a three-dimensional. In other words, including the mucosa. So, ito yung margin. Ang resection mo should be at least approximately this part. It's 1.5 to 2 centimeter outside. No visible tumor margin. So practically the whole lower eyelid, you may have to remove it. Ideally, you do a nose chemosurgery, but you don't have that. That is also expensive. So approximately that is what you're going to resect. Okay, so ngayon dito, look up please. Okay, so yun, kita mo doon. Involved na rin yun, namula na yun. So yung punctum will have to go. Okay. So now, after removing that, we need to reconstruct. And the reconstruction involves making a lower lid para hindi mag-dry yung kanyang eyes, no, yung sclera. Otherwise, magkakaroon ng keratitis, and then eventually, exposure keratitis, then eventually she might go blind. So we have to reconstruct the three-dimensional lower eyelid. So we have to put in mucosa, we have to put in a tarsus, and we have to replace yung missing soft tissue and skin. Okay, there are three sources. Open your mouth. For the mucosa, sige, and the tarsus will going to get here, okay, under local anesthesia, under nerve blocks. And then, for the thin part of the lower eyelid, we might have to use the excess skin in the upper eyelid. We're going to get the skin from the upper eyelid, including the orbicularis ocular muscle.